Case counts in Ontario are plummeting, the curve on a steep decline.
I think that we've learned from the first wave is that lockdown works.
While daily case numbers continue to ping up and down in various regions, the 7-day rolling average across the province has been steadily declining. As of today, it's just over 2,600 cases, down nearly 1,000 cases per day when it peaked on January 11th. Infectious disease specialist Zane Chagla credits the holidays being over and the lockdown for a drop in case numbers.
After that, I think people, had nothing else to do. I mean, everything's locked down. And so all the cases that are in the community now don't really have a lot of contacts for transmission.
Dr. Chagla says case numbers are just one metric to pay attention to.
Cases coming down are the first sign, but again, that probably isn't enough. If you see another surge and your hospital's already full, you're going to end up in the same scenario.
Dr. Bram Roshwerg works in the ICU at Hamilton Health Sciences and says there's still a ton of pressure on the system.
Our ICUs operate at full all the time, and that's not changed today.
He says Hamilton Health Sciences is surging patients into recovery rooms and other areas where ICU patients wouldn't normally go. Hamilton hospitals are currently caring for 109 COVID patients. They've also received at least 11 from outside the region due to load leveling.
You're trying to make sure that the burden of critically ill COVID patients is spread across healthcare systems to avoid overburdening one hospital.
How burdened are our hospitals here in Hamilton right now if we still have the capacity to intake patients from outside the region?
I think we are burdened. I think it's a reflection that we're less burdened perhaps compared to some of those other hospitals in the Toronto area.
Yesterday, Prime Minister Trudeau announced the government will send 2 mobile health units to the Greater Toronto Area. Joseph Brant Hospital in Burlington built its pandemic response unit last April and began taking patients 2 weeks ago. The hospital says it's caring for 18 COVID patients with 6 or less in the field hospital as numbers change daily. Now on Monday, Ontario Chief Medical Officer of Health Dr. David Williams said daily case counts will have to fall to around 1,000 to lift the lockdown, so still a long way to go to that number. As for the healthcare system, Dr. Roshwerg says Hamilton Health Sciences is still caring for patients that were admitted in December, so while daily case numbers are dropping now, it will still take some time to see it reflected in the healthcare system. He says maybe weeks, maybe even months.